Hi, my name is I, and this is my research article critique. So I was interested in researching about the importance of play in children's healthcare since I want to become a child life specialist, and play is an important component of the child life field. However, I wanted to see how play is used from another health professional's perspective. So my article critique is on understanding therapists' use of play with children with life-threatening conditions by Bambrick and Dennis. So just to give you an overview of what my article is about, two researchers named Bambrick and Dennis wanted to discover how and why occupational therapists use play when working with children diagnosed with life-threatening illnesses. In order to conduct their study, Bambrick and Dennis recruited 5 female participants that met their criteria. The criteria included working as registered occupational therapists, had worked with children between the ages of 3 to 8 who were diagnosed with serious illnesses, and were open to discussing their experience working with these children. For the study's method, Bambrick and Dennis chose to do a qualitative study using the narrative approach to gain a personal insight of how occupational therapists integrate play into their work. In response to the narrative approach, they conducted interviews with the participants, which Bambrick and Dennis derived common themes from the interviews as their results. The themes were play as means, playful moments, importance of play, and play at the end of life. Bambrick and Dennis also learned about the challenges that occupational therapists experience when trying to incorporate play into the work, such as condition-dependent limitations, which explains the certain health complications that prevented therapists from integrating play in their sessions with children, and reimbursements, which is the money that therapists receive from insurance companies from helping clients achieve certain goals. However, insurance companies do not pay therapists for incorporating play. In conclusion, occupational therapists use play to encourage their clients to achieve new goals and skills. However, there are some challenges that they also do face when trying to integrate play in their sessions. So the first part of the analysis is statement of problems and research questions. As mentioned in the last slide, Bambrick and Dennis conducted this study to evaluate how and why occupational therapists use play when working with children diagnosed with life-threatening illnesses. Bambrick and Dennis justify their reasoning for this study by explaining what pediatric palliative care is in the beginning of the article, which is the type of care that is provided to children with serious illnesses to improve their quality of life. Occupational therapists are one type of healthcare workers that provide pediatric palliative care, and they are geared towards providing healthcare that is meaningful. Therefore, they incorporate play into the work since play is a tool that helps children learn, interact with others, and promotes typical development. Previous research has also been done on adults diagnosed with life-threatening illnesses, and the research shows that adults stating that they regret giving up activities that give them pleasure and a sense of independence. Since play is an activity that children engage in as a sense of pleasure and provides them with a sense of independence, occupational therapists integrate play in their sessions with children to encourage them to achieve their goals and make their sessions with children more meaningful, which further justifies Bambrick and Dennis's reasonings for studying how and why therapists use play. Overall, I believe the research question of the article is clear for readers to pinpoint, and Bambrick and Dennis provide sufficient background information and research to validate the reasoning for conducting the study. The next part of the analysis will focus on the study's methods and procedures. Bambrick and Dennis used the narrative approach as their data collection method. According to the textbook, the definition of the narrative approach is the examination of the first-person stories or descriptions of one life that the researcher analyzes from the storyteller's point of view. Bambrick and Dennis conducted 3 interviews with each of the participants. The first interview was to learn about the therapist's backgrounds and work experiences. The second interview was to listen to stories about specific patients they worked with. And the last interview focused on in-depth stories about one specific treatment during each of the therapist sessions. The interviews were recorded so Bambrick and Dennis could transcribe them in order to analyze the stories that were told to contribute towards their results and conclusions, which will be discussed in the next few slides. Overall, readers can clearly identify Bambrick and Dennis's methods and procedures since the article has specific sections dedicated to explaining how their data was collected, analyzed, and interpreted. The narrative approach was an appropriate method in collecting their data since Bambrick and Dennis got to hear personal stories directly from the occupational therapist about the new skills and goals that children achieved from their use of play. For example, one therapist told a story about how she played the Hokey Pokey song that got her client to stand up for the first time in days. However, the researchers' qualitative data only provided one-sided perspectives among a small number of participants, which causes potential threats to the study's internal validity. In addition, relying on people's perspectives can make it difficult to replicate findings when other similar studies are done to discover how and why occupational therapists use play in their work with children. This is why I believe if Bambrick and Dennis used a mixed method approach, they could have made their study stronger. Using the quantitative method in combination with the qualitative approach would allow them to reach a higher sample set while receiving another perspective, such as the clients and families that the therapists work with, than solely just relying on the therapist's perspectives. Also, conducting a quantitative study would gain them numerical data to conclude their findings, which would be beneficial when other studies are done to also discover the effectiveness of play in healthcare, because they would have the numerical data to compare their findings to. So the next part of the article analysis is author's analysis of results and conclusions. So based on the interviews, Bambrick and Dennis concluded that play is beneficial within occupational work with children because it promotes meaningful sessions with their clients and was a useful motivational tool. However, there are some challenges that occupational therapists did experience when trying to incorporate play in their work. Although there were barriers that they experienced, occupational therapists continue to have a positive outlook to play, which supports the author's conclusions about the importance of play in pediatric palliative care. I found Bambrick and Dennis's conclusions to be convincing since healthcare workers other than occupational therapists utilize play when working with pediatric patients, such as child life specialists. And as mentioned in the first slide, I understand as a child life student firsthand how important play is in the field of child life. There was also a research study done by Burns Naders and Hernandez Reef about child life specialists and their duties, which explained how child life specialists minimize hospitalization stressors, promote typical development, and educate children about their procedures and treatments with the use of play. Therefore, it is convincing that play is essential in occupational therapists' work with children, since other health professionals like child life specialists also use play. So, the next part of the article analysis is resolutions to problems within the article. So it's mentioned in the slides about the author's methods and procedures. I believe that Bambrick and Dennis could have made stronger findings if they utilized the mixed method approach rather than just using the qualitative method. In their limitations section of the article, Bambrick and Dennis mentioned that they only had a small number of participants and gained only one-sided perspectives about the benefits of play, which is the perspectives of the occupational therapist rather than also relying on the perspectives of the clients and their families. In addition, qualitative data can be difficult to replicate results because their data is based on perspectives of individuals. Therefore, using the quantitative data in combination with their qualitative method could have allowed them to reach a higher sample set from another perspective while gaining numerical data that can make replications of results possible in future studies. An example of a quantitative method that they could have done is a parallel randomized trial. For instance, there was a study done by researchers named Potaz, Varela, Carvalho, Prado, and Prado to study the benefits of play. They studied the effects of play by recruiting pediatric patients, which they separated into two groups. One group got to engage in play activities, while the other group took daily strolls. Their cortisol levels were then monitored to compare their stress levels, which results show that the group of patients who got to play experienced less stress while in the hospital. This study had a higher sample set while gaining the perspectives of patients who were involved in play activities, and in the end, produced numerical data that future studies can compare their findings to. So the last part of the article critique is translating the article to a non-academic audience. So as my audience, I chose my adolescent sister. I would go about explaining the article to her the way I did in the abstract. I would tell her that two researchers named Bambrick and Dennis were interested in discovering how occupational therapists use play in their work with children diagnosed with life-threatening illnesses, since previous research has shown that play is a beneficial tool for children to learn while creating meaningful moments. So Bambrick and Dennis recruited 5 female occupational therapists who have experience working with children of the ages of 3 to 8 with life-threatening illnesses, which they interviewed to hear stories about their work with clients. From the interviews, they found common themes, which included play as means, importance of play, playful moments, and play at the end of life, which supports their conclusions that play is essential within occupational work with children. However, there are also challenges like the children's health complications that may prevent therapists from using play or insurance companies not paying the therapist based on their usage of play. However, occupational therapists still have a positive outlook towards play, which supports Bambrick's and Dennis's conclusions about the importance of play in occupational therapists' work with children diagnosed with life-threatening illnesses. And that concludes my article critique. Thank you.